If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Keep your dial tuned to 100.7 QFM as 15 diabetic-friendly minutes are about to come to your radio, all with the compliments of the Barbados Diabetic Eye Screening Program, the Barbados Community Foundation, and the Maria Holder Diabetes Center. This is Peter Boyce here, and good afternoon to all the Q family who are listening. We will be dealing with a budget today, but a different kind of budget. The budget of your health. If you are diabetic or pre-diabetic, we're eating, we're drinking, and have you been visiting the Maria Holder Diabetes Center located in Warren, St. Michael recently? If you are on a budget because money tight, there you will find a range of services at reduced prices.
How about a BART card? Does accept BART there?
Of course they do. BART members get a further 10% off services like vascular screening for if you feel you might have bad circulation, eye screening for diabetic retinopathy, the same way that the budget is once a year. Once you are diabetic, you should be getting your eye screen once a year too, and many other services you will hear about in this 15-minute segment.
The Maria Holder Diabetes Center, 243-3937.
But before I forget, Saturday was International Women's Day, so we will have a special song for all the beautiful, cute women who are listening. Listen out for that. And speaking of women, you're going to be hearing a lot of ladies in this show, starting with our first feature, because Saturday the 22nd of March is World Water Day. You didn't know that? And you know the Diabetes Foundation has always been in the forefront of pushing more Bajans to drink water. You should be drinking some now. So let's take a listen to this conversation between General Manager of the Maria Holder Diabetes Center, Miss Marsha White, and Mr. Alfonso. There's Alfonso here. Belated Women's Day to all the women listening to 100.7 QFM. You know, women is my favorite gender. And with that, I would like to introduce to the telephone line. Is that you, Miss Marsha White?
Yes, indeed, it is, Alfonso.
How are you doing?
Oh, I'm great. I've had a great week, and I feel very energetic.
Marsha, you is what I call a WW, the water woman, right? Yeah, because every time you hear you be talking about people should be drinking water, what it is when they don't drink more water. So I wanted to know, Miss Marsha, is why should people drink more water?
Well, you must know, Alfonso, that every cell in our body is made up of water. A lot of water, like more than half water. So if the cells get dehydrated, that means they're not going to be working properly, okay? And the one big organ that really needs a lot of water is our brains. And if, that's the central nervous system right there. That controls all of our decision making, how we feel, our hormones, like all kinds of stuff happens from that part of our body. So the biggest reason why we should drink water is to keep the cells and muscle of the brain working properly so that we can take care of the rest of everything.
So I want my cells and my brain to be working properly so I can go drink more water for true. But I got another water question for you, Marsha. Sometimes when I go to the fancy restaurants and things with the missus, the waiters just ask me if I want sparkling water or water. What's the difference between sparkling water and water?
That's a great question, Alfonso. So there are really two types of sparkling water. There is carbonated water, which is water that has been infused with carbon dioxide, and that's kind of a fun alternative to flat water. If you've been drinking a lot of water and you're bored and you want to consume more, it's fun to have some bubbles there, but that's about it. It's just bubbles. And then you have sparkling mineral water, which is one of my personal favorites because it also contains important minerals like potassium, magnesium, calcium. And, a lot of times, even if we're eating well, some of the soil that our food is grown in nowadays doesn't have the same level of minerals that it used to have. And then, of course, many of us are not eating enough vegetables and fruits and whole foods as we used to. We're eating a lot of processed foods, and they're often deficient in those minerals. And they're really important, those minerals, for the health of our blood vessels, our eyes, all of our organs, really, and in particular, our bones.
Thank you very much for that important information on drinking water, Marsha, because I'm going to be drinking more water, and I know the people out there listening to QFM, when they're going to Q in the community, they're going to drink more water too. And I look forward to hearing more from you as World Water Day coming up on the 22nd of March. I'm going to drink some water now.
The Maria Holder Diabetes Center.
As we move on from Alfonso, we now go to a special presentation that recently happened where the Amaran Charitable Trust recently donated a silk lamp to the Barbados Diabetes Foundation's eye screening program.
So exactly what's a silk lamp?
A silk lamp is an essential tool in ophthalmology, allowing for a detailed examination of the eye structures. Mr. David Sumerick of the Amaran Charitable Trust made the official donation to Dr. Diane Braffett at the Maria Holder Diabetes Center. Also in attendance was G.M. Marsha White, Miss Janelle Motley, and Mrs. Renee Griffith. Let's take a listen to the presentation where you're going to hear first Dr. Braffett and then Mr. Sumerick.
On behalf of the Maria Holder Diabetes Center for the Caribbean, I would like to thank you very, very much for the donation, very generous donation of the slit lamp. This is something that we have wanted for a long time, and we're happy to be able to have this piece of equipment to supplement, I would say, appropriate eye screening for persons living with diabetes. It will serve as a complement to the digital retinal photography that we do, the OCTs, and also the checking the pressure in the eyes or tonometry. So we're very grateful. What more can I say? Diabetic eye disease is a very big problem, obviously, as you know, in the world. In many places, the number one cause of blindness. And in Barbados, obviously, we have a slightly higher burden of eye disease, but in our clinic, we do see a bit more because a lot of our patients that we see have had diabetes for a longer period of time. So their risk of having diabetic eye disease is actually a little bit higher, maybe the average kind of person, out there on the road. So we are just happy that we're going to be able to, I think, bring just top level care and screening to our clients, who would include persons coming from the polyclinics in Barbados being referred to us. And all of the patients who come from the polyclinics will actually have eye screening. They've always had eye screening. It just allows us to give them a bit more now. So thank you once again.
Well, you're most welcome, and thank you very much for the good work that you all do here. We're very happy to have procured a few pieces of equipment to help you with your screening. And diabetes is a big issue here, as it is in other places. And eye care, or eye generally, is a big issue. As you mentioned to me before we got on, we were involved very significantly in a pediatric glaucoma initiative that we got involved with to bring it to Barbados, and it didn't quite get here. Beyond our control, but it was something we were very happy to get involved with, as we are very happy to be involved with your work here.
Okay, that's wonderful. But just as an aside, we want to let everybody out there know that you should have screening for diabetic eye disease. And conditions, people think they're not related, but they are. Glaucoma is actually more common in persons living with diabetes, as is cataracts. Glaucoma can be twice as common. So nothing is kind of separated. And at the end of the day, your eyes are your independence. And what they have been able to show in certain places is by having good screening programs, you can actually reduce the frequency, of visual loss due to diabetes. So that has happened in the UK, and this is why these screening suites are being set up throughout the world, basically.
No, I think I commend you for it. I believe that screening is essential to abating the effects of diabetes generally.
We would love to prevent everything, but we still have to treat people who have, conditions, complications, and early timely screening, to prevent advanced debilitating disease.
Well, generally, I've been a strong advocate of preventive medicine.
I agree, totally.
So anything that can help prevent disease or the disease getting more rampant throughout society, I think is fantastic. And if this helps, terrific. And I'm sure it will help.
It will help. Step 1, 2, we'll see where 3 and 4 take us next in the partnership. Thank you very much again.
You're most welcome.
Your trust.
You're most welcome.
Okay.
As we go from that generous donation by the Amaron Charitable Trust and Mr. David Sumerik to the Barbados Diabetes Foundation, we flow right into our Q Song of the Day. A song that we're playing for the ladies for International Women's Day that happened on Saturday, to Dr. Diane Braffick and GM Marsha White and all the ladies at the Diabetes Foundation who help to keep Barbados healthy, and all the strong, independent ladies listening to QFM. This is for you, Shaka Khan with I Am Every Woman. Compliments the Maria Holder Diabetes Center.
The Maria Holder Diabetes Center.
In our body is made up of water, a lot of water.
Hi guys, my name's Louise and I'm a podiatrist here at the Barbados Diabetes Foundation. Top tip for today, please examine your feet daily. Things to look out for, cuts and blisters, and maybe you've stood on something and you won't feel it because you've got neuropathy. Look out for swelling, temperature, burning. That could mean an infection. So please guys, get your friends, your neighbours, your family, just get your feet checked, and if you've got any problems, please come and see a podiatrist. Thanks.
For a long time I was prolonging not to have my eyes, I went to get an eye screening. I checked for a long time, but because of I had a cataract operation 5 years ago at the hospital, and then when they would go to the hospital, because of the amount of people that goes to the clinic there, you don't always get special attention. And just about a couple months ago, Diabetes Foundation, they had called me, Dr. Braffick, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with the result. Right now the cataract is under control, so I would say yes, that is very good. It's very good for diabetic.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES 243-3937 for more information.